So this is the result of a brain bleed. The person in this video is Aaron, and he reached out to me to share his story. As you can tell in this video, he has a breathing tube inside of his mouth, and he also has a tube coming out of his head called an external ventricular drain. He was shown to be in a comatose state, and this tube was placed inside of his head to relieve pressure after the brain bleed took place. You can see on his CT scan that he has a very large hyperdensity on the right side of the brain. This hyperdensity is the area where the bleeding took place. So as neurosurgeons, one of the things that we can do is take the person to the operating room and cut a big incision in their head and remove half of their skull. The idea behind this is to evacuate any sort of blood if we can gain access to it, but more importantly, it's to relieve pressure. And just like in this situation, Aaron had his skull removed and it was kept off, and the skin was closed on top of the brain. And that's why you can see him walking around with a helmet, because he needs to have protection because there's nothing but skin and brain on the right side of his head. You can see that over time he started to recover. And he also sent me this private video where he's kind of poking